the health benefits and to discuss the health benefits of physical activity and awareness about correct use of different exercise modalities. In the last session, we have studied about basics of diabetes, and the session was taken by Dr. Praveen Dani sir. Today, on session 2, which is on medical management of diabetes, we have Dr. Basawant Dhudum, who is Associate Professor in Bharati Vidyapit College of Nursing. Sir has done, his specialty is in medical surgical nursing. Dr. Basawant Dhudum is Associate Professor in Bharati Vidyapit. Sir has done his BSc Nursing in Government Medical College, Bangalore. Sir has also done his MSc Nursing in Bapuji College of Nursing, Davangere. Sir also has done his PhD Nursing in Bharati Vidyapit College of Nursing, Pune. Actually, it is Pune. Sir has an experience of 15 years of teaching, and his specialty is medical surgical nursing. The publications which Sir has done is 20 research publications with 30 citations. I welcome you, sir, for today's session. And we are really pleased to have an expert speaker. He is a well-versed person who will enlighten us more about the subject with his thoughts, his experience, and his learning. I welcome you, sir, once again on behalf of College of Nursing, and I request sir to start the session on medical management of diabetes.
Thank you, Shilpa Madam, for a wonderful introduction. Can you hear me?
Yes, sir.
Yes, sir. Yes, sir.
Okay. Can you see my screen?
Yes, sir. Yes, sir. Your screen is visible. Yes, sir.
Okay. Good afternoon to one and all. First of all, I would like to thank ECO team and Bharati Vidyapit and Dr. Nilima Bore Madam, the Dean Faculty of Nursing, and Dr. Praveen Dani sir, Vice Principal, College of Nursing, Sangli, for giving me an opportunity to speak on the topic that is medical management of diabetes. So before wasting time, let us start with the session. In the previous class, Dr. Praveen Dani sir had shared knowledge regarding the basics of diabetes mellitus. Now, today we'll be learning about medical management of the diabetes. So the objectives of the today's session are to have a brief understanding of different treatment modalities of diabetes management, to understand non-pharmacological therapy, pharmacological therapies, and common oral anti-diabetic combinations, and the comprehensive diabetes management. So let us have a brief introduction on diabetes mellitus. That is, diabetes mellitus, as we know today, is a leading disease, and India is also not less. That is, we are ranking second in the diabetes mellitus cases, and that is why today we are having this session. So, role of diabetes educator is to explain the importance of non-pharmacological and pharmacological diabetes management, make the patient understand how and when to take medicines, importance of timely and regular drug or insulin intake, and discuss the common adverse effects of anti-diabetic medications and ways to minimize the same, thereby improving the patient adherence and compliance. So this is the major role of the diabetes educator as concerned with the diabetes management. As we know, diabetes, though it is a common disorder, many of us will consider this disorder as a common disease, and we neglect the care towards diabetes mellitus. But we are not supposed to do, because the complications related to diabetes mellitus are very severe. So hence we need to focus a lot on the management of diabetes mellitus. And that is why today we are having this session. The aims of diabetes management is maintain blood glucose level and control high blood glucose levels and maintain optimal levels. I'd like to highlight in here that is we need to maintain the optimal levels. Many of us, we say that we have to reduce the blood glucose level, but we are not supposed to reduce the blood glucose level. It is not safe even if the blood glucose level goes down the normal level or even if it increases. And that is why we need to maintain the optimal levels. Then we need to prevent or delay the complications of diabetes mellitus, as there are a lot of complications related to diabetes mellitus. So we need to prevent those complications and we need to delay the complications of diabetes mellitus. Then proper drug selection according to the patient profile. So the treatment what is given to the patient, that should be based on the patient's condition. Based whatever the patient require, that particular treatment should be started to the patient. Then we need to maintain the quality of life and psychological well-being of the patient, which is the most neglected part in the diabetes care. So very important is to maintain the quality of life of the patient and psychological well-being of the patient. So to manage diabetes mellitus, there are two ways. Either one is non-pharmacological management and the other is pharmacological management. So under non-pharmacological management, we have many options, like say lifestyle managements are the cornerstones of the diabetes. So here we have medical nutrition therapy, physical activity, and weight loss. Now you might be thinking, what is medical nutrition therapy? Now this medical nutrition therapy is you are using nutrition as a therapy to treat the patient, to control the diabetes or prevent the complications. So the diet is used as a therapy. In a common people like you and me, we use the word balanced nutrition, which we are supposed to maintain a healthy life. But in case of the patients, person who is suffering with diabetes mellitus or hypertension or any kidney diseases, in that case, we need to alter the nutrition of the patient and we have to give a tailored nutrition to the patient. Here, this is planned by a dietitian who is an expert in the nutrition field, who will give treatment or who will give therapy, nutritional therapy to the patient according to the need of the patient. So it is a tailored nutrition, individualized nutrition therapy should be given. Here, many of us, what we do is we generally give a diet to everyone, same diet to everyone. Just like say, for example, for diabetes patient, we have to consume less carbohydrate. Or in that, or else say hypertensive patients, we say that we are supposed to give less or decreased sodium intake should be taken for the hypertensive patients. So we just generalize the nutrition. Actually, it is not appropriate. The appropriate therapy is you have to give a individualized and tailored diet therapy to the patient. Now, the patient suffering with the diabetes mellitus can also have hypertension or any other cardiovascular diseases, or else he may have even kidney diseases. So in general, nutrition cannot be given to this patient. So as per the requirement of the patient, as per the condition of the patient, we are supposed to give the tailored or unique nutrition diet plan to the patient. Again, more light will be thrown on this topic in the later sessions. So I'm not going to go more in detail regarding this. Next, coming towards the physical activity. Now you are taking a proper diet, proper nutrition, everything, individualized nutritional therapy, but you are not doing any physical activity, which will not support your treatment, which will hamper your nutritional therapy. So that is why very important part is not only taking the appropriate nutrition diet, but you are also supposed to do the physical activity. Many of us, including you or me, most of us don't do any sort of physical activity. Most of the time we do our work sitting in one place, and which will not allow us to burn our calories. So very important part is again the physical activity. Again, on this topic, the light will be shed in the later classes. Then next coming towards the weight loss. Now this weight loss is for majorly for the patients who are obese. 50% of your treatment is will be effective only by only by doing the weight loss, especially in case of I'm telling you in case of obese patients, not the persons who are lean. The persons who are obese have to lose the weight. That is again very important. It will improve your effectiveness of your therapy, or it will help you to control or manage your diabetes. Next, other part is we are going to go with the pharmacological therapies. In pharmacological therapy, again, we have oral glucose lowering agents and insulin. So these are the two parts which are used in the pharmacological therapies. That is the oral medications and insulin. So in this class, I am going to shed light only on the oral glucose lowering agents, and insulin, it will be dealt in the later class. So which are the available therapeutic options for the oral anti-diabetic drugs or oral hypoglycemic agents? These are either called as oral anti-diabetic drugs, and also they are also called as oral hypoglycemic agents. Now, these oral anti-diabetic drugs or oral hypoglycemic agents are given only in type 2 diabetes mellitus. It is not given in type 1 diabetes mellitus, where in type 1 diabetes mellitus, only insulin is the treatment which you are supposed to give. Here, you cannot give the oral anti-diabetic drugs. So the oral anti-diabetic drugs or oral hypoglycemic agents are given for the type 2 diabetes mellitus patients only. Okay. Now, the category which is available, which are the available drugs we can see, they are categorized into bigunide. Bigunide, the drug name is metformin, which is very common. We have, all of us, we have heard very commonly about this drug. There is the metformin. It comes under the category bigunide. Then the next category is sulfonyl urels. Sulfonyl urels, here we have the drug category names, that is glimepiride, then glibenclamide, and gliclazide and glipizide. So these are the drug forms which are available in the sulfonyl urels. Next, the category is thiazolidine. In this, we have pioglitazone, alpha glucoside inhibitor. This is commonly called as AGI. Under this, we have acrabose and voglibose. Then we have the next category is dipeptidyl peptidase 4 inhibitors. Under this category, we have vildagliptin, sitagliptin, sexagliptin, and linagliptin. So these are the drug forms available under DPP-4 inhibitors. These are commonly known as DPP-4 inhibitors. Next category we have is glucagon-like peptide 1, that is commonly known as GLP-1 agonist. So under this category, we have exenatide injection and liraglutide injection. Now, this is the only category which is available in the form of injection. This is the only drug which is available in the form of injection. And these drugs are more effective, but the major drawback with this category is that it is most costly. It is around 2,500 to 3,000 rupees per injection. And this treatment is given for the obese patients also. This is very effective in the reduction of the obesity. So this is the only available form in the injection form. It is given in the subcutaneous form. And the major drawback, though it is effective, the major drawback is that it is very costly. It is very expensive treatment. And nowadays, even the oral medications are being tested. Still, it is not available into the market. But even oral medications for the GLP-1 agonist are being under research. Then the next category we have is sodium glucose cotransporter 2 inhibitors. They are commonly known as SGLT2 inhibitors. This is the commonest known, that is SGLT2 inhibitors, that is sodium glucose cotransporter inhibitors. Under this category, we have canagliflozin, dapagliflozin, and empagliflozin. So these are the drugs which are available under this category. And the other preparation we have is the insulin preparation. This can be given in both, that is type 1 and type 2 diabetes mellitus. Oral anti-diabetic medications are given only in case of type 2 diabetes mellitus, but insulin can be given for type 1 and type 2 diabetes mellitus. In both the cases, we can give. And this is available in the form of short-acting medications, intermediate-acting, long-acting, and analogs. Now, I'm not going to go more in detail regarding the insulin therapy, since in the next class, we'll be listening about the insulin therapy. So I'm not going to go in more detail regarding this. Here, one important thing I would like to highlight is analogs. Now, here analogs means it is the specially engineered hormones, hormonal treatment, which enhances the treatment of, or which increases the effectiveness, or it will increase the duration of the insulin preparation. So these are very commonly used nowadays, analogs. Now, the oral anti-diabetic drugs, we shall see what is the mode of action or mechanism of action here. So here we have the metformin. Here, this metformin tablet, the mode of action is here. It reduces the hepatic glucose production and decreases the insulin resistance. So we here the major thing what the metformin is going to do is it will reduce the glucose production in the liver, that is liver, and it will decrease the insulin resistance, which is very common in the type 2 diabetes mellitus. And this metformin is the only tablet which is considered as a safe to give during the pregnancy. Next, sulfonylureas. The mode of action is it will stimulate the beta cells in pancreas to increase the insulin secretion. So it will increase the insulin secretions. When you give sulfonylureas, it will increase the insulin secretion. It is not going to do anything with the insulin resistance. It is going to only increase the insulin secretion. So the major drawback of sulfonylureas is, that is it will cause hypoglycemia. So you need to be very careful when you are giving the sulfonylureas. Next, pioglitazone. The action is it will reduce the insulin resistance in the body tissues. Again, the action of pioglitazone is it will reduce the insulin resistance in the body tissues. AGI, that is alpha glucose inhibitors, it will reduce the absorption of carbohydrates from the intestine. It is not going to do anything with the insulin resistance, or it is not going to do anything with the insulin secretion. It is only going to reduce the absorption of carbohydrates from the intestine, thereby reducing the glucose level in the blood. Next, we have category is DPP4 inhibitors, that is dipeptide peptidase inhibitors, which will reduce the degradation of incretins. Now, incretins are the metabolic hormones which are released after eating food. After taking your meals, these incretins are released into the bloodstream, which will support the insulin for the effectiveness or reduction of the glucose level. So they are very much important. This is incretins. It is normally secreted by the body when you eat the food or after taking the meals. So these DPP4 inhibitors, what they do, they will prevent the destruction of these incretins so that the incretins are preserved and it will enhance the reduction in the glucose. Next category what we have is GLP-1 receptor agonist. The action of this drug is it will stimulate the secretion of incretins. Now, this is this is available only in the form of injection. This is again, I'm repeating again, this is very much effective drug, but the major drawback is it is very costly. And this drug is very commonly used for the reduction of weight, that is for the obese patients. So they are becoming very popular among the for the obesity treatment. Next, SGLT 2 inhibitors, that is sodium glucose cotransportase inhibitors. This will increase the urine glucose secretions. Now, again, this is not going to do anything with the insulin or the glucose level. It is going to remove the glucose from your body through the urinary system. So this is the main mode of action of the oral anti-diabetic drugs. Next we have is, let us check with the one by one drugs, that is biguanides. What are the dosage, contraindication, adverse effect, and comments. So biguanides, it is available in the form of 250 mg, 500 mg, 850 mg, and 1000 mg. So these are the available forms of biguanides, or it is commonly known as metformin, which is available drug. And it is written as here, you can see metformin SR. SR means sustained release. Sometimes in few drugs, when you take some drugs, you can find these terminologies, that is SR or MR or XR. So SR stands for sustained release, XR stands for extended release, and MR stands for modified release. So that means it is going to enhance the effectiveness of the drug, or it is going to maintain the action of the drug for a longer duration. So that is, they are genetically engineered like that, so that the action of the drug remains for a longer duration. So the dosage, usually the maximum recommended dose for the biguanides or metformin is 2,500 mg per day. You should not exceed the 2,500 mg per day dosage, and it is usually taken with the meals. The contraindication for this drug is if the patient is having any liver disease, or the patient is consuming alcohol, or if the patient is having any kidney disease, this particular drug is contraindicated. It is not supposed to be given. Then the adverse effect of the drug is abdominal discomfort, diarrhea, and nausea. And this abdominal discomfort is the major adverse effect for the metformin. And that is why it is told to take this drug with the meals. Here, GI discomfort can be reduced if low dose is started and gradually increased. As soon as the patient is given with this treatment, started with this treatment, the patient most frequent complaint is the abdominal discomfort. Now, this discomfort can be reduced by giving low dose at the start and gradually increasing the dose. Most of the time, few patients may complain that the metformin tablet can pass out in the stools, which is, again, it is normal. You can inform the patient that it is normal. You need not worry. Already the action, what has to be done by the metformin is already done. So there is no harm even if the metformin tablet passes out into the stools. So the top Indian brands which are available here is Glycomet, Gluconol, Glycipage, Cetapin, and Gluformin. So all these are the brand names of the drug metformin. So, or biguanides. These are very commonly used in the India, and that is why I have given this information. I request participants, if you have any doubts, you can stop me in between, or if I'm going very fast. Next, the category of drug which you are having is sulfonylureas. Now, this sulfonylurea, these are the drugs which are available under sulfonylureas, that is glimepiride, glibenclamide, glipizide XR. Now, this XR stands for extended release. Then glicazide, MR. Now, again, this MR stands for modified release. The available forms, doses are in glimepiride, we have 0.5, 1, 2, 3, or 4 mg. These are the available doses in this glimepiride. And this drug is contraindicated for the pregnancy, nursing mothers, and kidney diseases. Then glibenclamide, the available dose is 2.5 mg, 5 mg, 10 mg. Again, this is contraindicated in pregnancy, nursing mothers, liver or kidney diseases. Glipizide XR, the available form is 2.5 mg, 5 mg, and this is not 40 mg, this is 4 mg per day. Then XR, this is available in 5 mg and 20 mg per day. Again, this is contraindicated in pregnancy, nursing mothers, and liver disease. Now, this gliclazide or gliclazide MR, this is available in the form of 80 mg and 80 mg to 320 mg per day. And gliclazide MR, it is available in 30 mg to 120 mg per day. Now, again, this is contraindicated during pregnancy, nursing mothers, and the elderly. These drugs can be taken before food for better absorption. This drug should be taken before meals or before food for the better absorption. The major adverse effect of this drug is the hypoglycemia and weight gain. So you need to monitor for the hypoglycemia and weight gain when the patient is on this sulfonylureas. And especially you have to monitor for the, if the patient is pregnant or having, if the patient is nursing mother, or if the patient is having any liver disease or kidney disease, then we need to be very, very careful on monitor for the patient. And these drugs are not supposed to be given if at all, if the person is having all these conditions. So even if you identify if the patient is on sulfonylureas and having pregnancy, or if she's a nursing mother, then immediately it should be stopped. It should be, this message should be conveyed to the physician and see that this medication is stopped immediately and shift to the other dosage. Like here, you can shift to the insulin treatment. So in this case, if we are unable to give these drugs, you can shift to the insulin, or else even metformin is the can be given safely in these cases. Yeah. Next is, sorry, pioglitanize. Now this drug is available in the form of 7 mg, 15 mg, and 30 mg. The dosage here is maximum recommended dose is 45 mg per day. You are not supposed to exceed 45 mg per day. The contraindication again here is liver diseases, heart failure, renal disease, or active bladder cancer. These are the contraindications for the drug. It should not be given here. Then the major adverse effects of this drug is again weight gain, fluid retention, edema, anemia, fracture risk in the women. Even if the woman is elder, if she is menopause, and if she is having risk towards the fracture, in that case, you are not supposed to give this drug. Again, this drug can be taken with or without food. There is no, you can take before food also, you can take after food also. There is no problem with the taking of this medication. Now, again, top available brands in this are Pios, Pioglit, Piosis, Pioclair, and PAP. So these are the common Indian brands which are available in this drug form. This drug should not be used as a first-line therapy for the diabetes patient. This is not a first-line choice of the treatment. It can be given to the patient. This is the next level of the treatment. Clear? If the patient is having active bladder cancer or with a history of bladder cancer, and those with the uninvestigated hematuria should not receive pioglitazone. Why? Because again, this is harmful. It is having an adverse effect, that is anemia. So if you give this drug here, again, the anemia is going to increase. And that is why in this case, if the patient is having hematuria or active bladder cancer, in this case, you are not supposed to start with this drug. There should be a periodic review of the therapy for the safety, because this is having a major side effects, that is the fluid retention, edema, anemia, and fracture. So these are major risk factors, major adverse effect which this drugs is given. And that is why there is a periodic review should be done for the safety of this drug. Next, AGI inhibitors, that is alpha glutidase inhibitors. In this, we have acrabose and voglibose. These are the two drugs which are available here. So acrabose, the dosage available here is 25 mg to 300 mg per day. It should be taken with first bite of every major meal. This drug should be taken with the first bite of every major meal. The drug is contraindicated, that is chronic intestinal disorders, severe hepatic and renal diseases, pregnancy, and nursing mothers. So in these conditions, you are not supposed to give these drugs. Adverse effect, it is having flatulence, abdominal discomfort, and diarrhea. And that is why, again, this drug is given with the first bite. That is why the drug is given with the first bite of every major drugs. So, the comments here is flatulence may be minimized by starting with a low dose and gradually increasing the dose. May cause hypoglycemia when used with the other drugs. So when you are giving these drugs, so check for the any combination therapy. So this drug can cause hypoglycemia if you are giving in combination with these drugs. And the abdominal discomfort or flatulence which is going to occur with this drug can be reduced by giving a small dose at the start and gradually increasing the dose. So that will not cause any abdominal discomfort. Vaglibose, it is available in 0.2 to 0.9 mg per day. So this drug should be taken with first bite of every major meal. So the contraindications and adverse effects remains the same for the patient. So this drug should be taken with the first bite of the meals. Next is DPP-4 inhibitors. Now, in this DPP-4 inhibitors, we have again these 4 drugs available. That is gliptin. This available dose is 50 mg to 100 mg, and it is contraindicated in known hypersensitivity, hepatic and end-stage renal disease, and pregnancy and lactation. So this drug is contraindicated in these following conditions. Then sitagliptin, we have 25 mg, 50 mg, and 100 mg. The known contraindication is, again, if there is a known hypersensitivity. I'm saying here the word known hypersensitivity, that if at all, if the patient knows he is hypersensitive to this particular drug, then only you can stop, or else there is no harm in giving these drugs. Saxagliptin, we have 2.5 mg and 5 mg. Again, contraindication in known hypersensitivity. Next, the linagliptin, it is available in 5 mg. It is given, again, this one is also contraindicated in known hypersensitivity, or else there is no contraindication for giving this drug. This drug can be taken with or without food again. Yeah, all these drugs can be taken by the patient with or without food. The next drug available is GLP-1 receptor agonist. Yeah. So these drugs here available forms are, again, as I said these drugs are available in the form of injection. This is only drug which is available in the form of injection. Yeah. And these are very commonly used, as I previously highlighted it, that this is commonly used for the obesity purpose nowadays, as to reduce the obesity of the patient. And these drugs are available in the form of injection. So exenatide, it can be given 1 hour before the meals, and it is given subcutaneous. The dose available here is 5 mcg micromilligrams. So here this drug is again contraindicated in case of end-stage kidney disease or renal impairment, or then pregnancy or severe gastrointestinal diseases. So in these conditions, the drug is not supposed to be given. The major side effects here are nausea, diarrhea, abdominal discomfort, headache, hypersensitivity, acute pancreatitis. So these are the major adverse effects of the drug. The other available drug is liraglutide. This is again, this can be given or taken by the patient with or without food. But exenatide, it should be given properly 1 hour before the meals. It should not be given after the meals. But liraglutide, you can give with or without food. And this is available in the form of pre-filled pen. Yeah. So the available form of this dose is 6 mg. And again, the contraindication and adverse effect of the drug remains the same. Again, I would like to highlight this is the most effective treatment available for the diabetes mellitus. But again, coming towards the expense of these drugs, that is why it is in the most of the cases, this particular treatment is not given for the most of the patients because it is not affordable. Because as I said you, it is around 2,500 to 3,000 rupees per injection. So this injection is given weekly once or as per the depends with the condition of the patient. It can be this drug is given weekly once, and liraglutide it is sometimes given daily once. So this spending 2,500 rupees or 3,000 rupees per week or per day is very difficult for a people, and that is why most of the time this treatment is not suggested for the patient. Any doubts? Okay. The next available form we have is SGLT2 inhibitors. This is sodium glucose co-transportase inhibitors. Now, in this available forms is canagliflozin, dapagliflozin, and empagliflozin. Canagliflozin available strength is 100 mg to 300 mg. Dapagliflozin, it is available in 5 to 10 mg, and empagliflozin, it is available in 10 mg and 25 mg. So the contraindication for this drug is again hypersensitivity, end-stage renal disease, or severe renal impairment. In these cases, you are not supposed to use this particular drug. The adverse effect of this drug is genital mycotic infections, increased urination, urinary tract infections. So these are the common adverse effect. So we need to monitor. If you are giving these drugs, we need to monitor for these conditions very safely because these are the commonest adverse effect of these particular drugs. Now again, these drugs can be taken with or without food. So SGLT2 inhibitors are the comparatively newer class of agents. These are the comparatively newer class of agents. So the common combinations of oral anti-diabetic drugs which are available in today's market will be you can see the slide over here. These are the common as the combination treatments which are available in the market. Here you have the medication name and here you have the brand names. So glimepiride and metformin combination, which is called in the brand names which is available is Glycomed GP, Gimer, or Zoril M. These are the brand names of the drug. Glimepiride and metformin, which is the brand names are Glucored, Dibeterol, or Duotrol. Glycoside and metformin, we have Glizide M, Dinorm M, and Dibend M. Then glipizide and metformin, here we have a brand name, Glycanase MF. Pioglitazone and metformin combination, we have Pios MF, Piokind M, Pioglip. Then Veglipose plus metformin, we have the drug available, Volibo M, Volixium, Ogliter MF. Then we have gliptin plus metformin. Here the brand names are Jalrayam, Glavasmet, Janumet, Istamet, Zitamet. Then metformin plus glimepiride plus pioglitazone. These are the three drugs, combination drug we have. That is triglymisave, triglinase, and tripride. Then another metformin plus glimepiride plus pioglitazone. Another we have is triglyceride 4. The other combination is metformin plus glimepiride plus voglibose. Here we have glycomet triovolib, and glimepiride MV. So these are the combination therapies which are available, which will enhance the effectiveness of the treatment, or it will increase the strength of the drug so that the diabetes is well managed. So here I would like to end with the topic. If you have any doubts, you can clarify. Any doubts?
Dear participant, please, if you have any doubts, please ask.
Participant, please, if you want to ask anything, please ask. And if you can use chat box also.
If participants have any doubt, kindly ask, or you can write your message or your question in the chat box.
No doubts? We will stop this. Thank you very much.
Thank you, sir. That was really a long list of oral anti-diabetic drugs, and it was a very knowledgeable presentation. My sincere thanks for your exceptional presentation and knowledgeable session at today's diabetic care. Your insight and expertise made a significant impact, and we are grateful for your valuable contribution. Thank you once again for sharing your knowledge on medical management of diabetes. It was crystal clear like water, and it was transparent as a crystal. I hope nobody has a doubt. And as sir has explained each and everything very deeply and clearly. Thank you once again, sir. Now, I request Miss Sairendri, staff nurse, Bharati Hospital, to present the case on diabetes.
Vishal sir.
Sairendri Patel, I hope she's ready for the presentation.
As I'm audible?
Yes, you are audible.
You can share PowerPoint from your side.
Yes, sir. Yes, sir. So I need permission for the share my host disabled participant screen sharing.
Ma'am, can you make that?
Yes, sir. Yes, sir. Yes, ma'am. We can try. Screen is visible for everyone? Yes, yes. It's visible. Yes. Thank you. First of all, good afternoon, everyone. Myself, Sairendri Patil. Before starting my guest presentation, I would like to thank the Eco-India System Project and the Bharati Vidyapit and Dr. Nilima Bhore ma'am and Dr. Pravindani sir and all the dignitaries, those who are giving me the opportunity to present my case here. So thank you all of you. Let's move towards my case presentation. The 50 years male patient named as XYZ admitted in a hospital at the 12th April 2024 with the chief complaints of increased thirst, frequent urination, and unexplained fatigue since 6 days. The past history of patient is cardiovascular stroke, last 3 years on meditation, and the doctors diagnosed with this the client with the type 2 diabetic mellitus with the hypertension. The client has social history, has the sedentary lifestyle due to his heavy day job and the rarely exercise. And the main diet is client is the highly processed food with the habit of drinking sugary beverage. He has been smoker for 20 years, but recently he stopped the smoking. Client does not have any significance of history of surgery, blood transfusion, IV drug therapy, or the tattooing. Also, the patient's family genetic history is not available for the genetic conditions for the diabetic mellitus. So the diabetes is totally for the sedentary lifestyle and the lifestyle modification. As we go with the physical examination, the vital signs of the client is temperature is 97.6 degree Fahrenheit, pulse is 98 beats per minute, respiration rate is 22 beats per minute, blood pressure 150 by 90 mm of Hg. Total appearance of patient is well nourished with the weight of 80 kg, height 160 centimeter. With this calculation is BMI is 30, comes under the class first obesity. The systemic examination for the client is the cardiovascular system found with the no any chest pain, tachycardia as we found in the vital signs only. Pulse rate is 98 beats per minute, so it will be a tachycardia with the no any murmur. Respiratory system with the clear breathing sound, no any cough or wheezing sign. Gastrointestinal system with the abdomen is soft and non-tender, bowel sound is normal, no any sign of nausea, vomiting, or etc. In neurological system, we found with the client as a tingling sensation in the both the feet. So muscular culture system with the no joint pain, no swelling, full range of motion in upper and lower extremity. Then integumentary system with the found with the no rash, no itching, and all the peripheral pulses are the palpable. As we go with the investigation, the on admission, we found the patient's admission date is 12th March 2024. The on admission, we prescribed the complete blood count with this HB we found in the 8.8 gram per deciliter. As we go with the values, the value is the decrease than normal. So we found with the patient with the anemia. The WBC is 7,100 per cubic mm. Platelets are 3,44,000 per cubic mm. Though WBC and platelets are the normal rate. Again, we found with the serum electrolytes, the sodium level is 145 millimole per liter and the potassium level is 3.5 millimole per liter. Both the values are normal. We go with the again random blood sugar level at this patient on same day of the admission. We found with the 250 gram per deciliter, the again value is increased. As we found the patient is admitted in a hospital with the middle day only, so we can't go with the fasting. So again, next day we are go with the fasting BSL and the HbA1c. So fasting BSL is 145 gram per deciliter and the HbA1c as compared to be found with the 7.8 gram. So both are the values are the higher than the normal. So as we are achieving the nursing profession, we have to go with the nursing assessment. Again, we are go with the vital signs. The temperature is 97.6 degree Fahrenheit. Pulse is 98 beats per minute. Respiration is 22 beats per minute. Blood pressure is 150 by 90 mm of Hg. As we go with the anthropometric measurement, it will be a weight for the 80 kg, height will be 160 centimeter. Skin here we found with the pale in color. As we go with the skin, the patient found with the 8.8 HB. So we found with the patient with the pale in color. Respiratory system with the cylindrical shape in chest, no any abnormal sound, no any sign of jugular vein distension. And cardiovascular system we found with the S1 and S2 normal, and the tachycardia is present, and the paper found with the patient with the cyanosis is present. GI system, normal bowel sound, no any signs of constipation and diarrhea. Now we are moving towards the medical management. Here we are going to divide the medical management in two sections, before admission and the after admission. The before hospitalization patient is go with the first tablet is tablet glycomet trio 2 by 0.3. Here we go with the Dr.Basawant lecture. So combination of drug we found here, the glimepiride 2 mg plus metformin 500 mg and the voglibose 0.3 mg. The three drugs have the combination and work as the anti-diabetic drug, which is helps to control the blood sugar level. And the dose is BD. It means the before breakfast morning and the before dinner at the evening. Second drug is The tablet immigrant hydrocort, which is the DPP4 inhibitor or the gliptins, which is helps to increase the insulin production. This tablet is also in a BD dose. Next one is the tablet Novastat ASP 20 mg, which is the again combination drug for the aspirin 75 mg and the rosuvastatin 20 mg. As we found with the client with the cerebrovascular accident previously last year, so we have to found with the patient with the antiplatelet drug with class statins, which is helps to lowers the bad cholesterol and the prevention from the cardiac diseases. This tablet is prescribed as by doctor only for the bedtime only. We found with the HS only. The tablet Telvas. Again, we found with the patient with medical history as hypertension. So telmisartan with the 20 mg agonistin receptor blocker antihypertensive tablets, which is prescribed by the doctor, is the OD. It will be goes with the morning session only. Tablet dapagliflozin, which is the sodium glucose co-transportase 2 inhibitor. It lowers the blood sugar level by causing the kidney to get rid of more glucose in the urine. It will be again helpful for the treatment for the diabetes. This all management is the patient prescribed with the before hospitalization. After hospitalization management, here we are go with the, we found with the first section of the before management, the tablet glycomet trio is again you get the hold by the doctor, and we found the number 6 injection human actropate 70/30 is the replaced by the oral hyperglycemic tablet. So we are again go with the tablet immigrant hydrochloride, Novastat, Telvas, dapagliflozin, and again we found with the newer drug, which is the tablet pantoprazole, which is proton pump inhibitor, work as the antacid during the hospital session. And we are to found the new drug in the patient medical management. This is the injection human mixed start 70/30, which is again combination of human insulin 30% and nitroglycerin hexagon on the human insulin 70%, which is acts as a fast acting soluble and the long acting isoprene. Before start as admission, which we start the patient with the sliding scale of the insulin as per the BSL charting from the we are go with the 3 times BSL charting with the before breakfast, before lunch, and the before dinner. At the time of discharge, we are go with the sliding scale with this. This is the 10 minutes morning and 10 minutes the evening. As we are go with the nursing management. Here for the nursing management, we are going the 3 sections. First with the nursing diagnosis. For this nursing diagnosis, we are going to plan a nursing goal. And for achieve this goal, we are go with the interventions for this. The first nursing diagnosis is ineffective therapeutic regimen management related to insufficient knowledge. Here we found with the client with insufficient knowledge. Is the client is for the heavy text duty, but also he is not belongs to a medical field. So we have to go with the first knowledge. So our goal will be describe the self-care measures that may prevent or decrease the progression of the chronic complications. For achieve this goal, we are go with the intervention such as appraise the client current level of the knowledge. Before starting with the knowledge session, we have to go with the baseline data. How much patient have the knowledge regarding disease? We have to go first with the appraisal of the patient current level of knowledge. Then we have to go with the describe the knowledge disease condition. Then discuss rationally behind the therapy and the management. Instruct the patient to measure to prevent complication and minimize the symptoms. Refer the patient to local community agencies to continuing support and education. If patient is not possible, if patient's condition is not possible to the follow up to come the same hospital, then we have to, as a staff nurse, we have to refer the patient for the community agencies for the follow up also. The second nursing plan will be imbalanced nutrition more than body requirement related to intake of excess of activity expenditure evidenced by weight gain. As we found with the BMI scale also, we found the patient with the obesity first class. So we found the patient with the patient gaining the weight too much. So we have to plan the goal according to the patient BMI also with the evidence base. The goal will be to maintain balance of nutrition, activity, and the ideal weight. For achieve this goal, we have to interpret that assess the patient to accommodate food preference into the prescribed diet to improve the compliances. Refer patient to dietitian to provide the continuing diet education. As we found with the Dr.Basawant, the every person have the different body weight, every person have the different choices for the food. Then we have to go with the dietitian or the expert opinion for the diabetes consultation. Then we have to go with the informed patient to the purpose and benefit of activities and the exercise prescribed. Here we have to go with the tailor exercise. Every person has the personal tailor exercise. For the we have to go with the instruct the patient how to monitor tolerance of the activity. As patient found with the hypoglycemic condition, sometimes patient have the hyperglycemia due to the drugs. So we have to go with the tolerance of any exercise to tolerance of any activity for the prevent the injury. Then last will the facilitate the adherence of diet and exercise regimen to promote the diabetic control. The third nursing care plan will be a risk for injury related to decreased tactile sensation and the episodes of hypoglycemia. The goal will be experience no any injury resulting from decreased tactile sensation and the episodes of hypoglycemia. As we found with the medical management of so many drugs, so some drugs causes the hypoglycemia to the client. So we have to give the education regarding the how to prevent the hypoglycemia also. For the achieve these goals, we have to go with the provide the information regarding relationship between the neuropathy injury and the vascular disease, risk for ulceration and the lower extremity amputation, caution about potential sources of injury to the feet, for example, heat, cold, and barefoot walk. Instruct the patient to examine shoes daily for the insects and the foreign objects. We have to especially instruct those clients who are working in the agricultural land or those who are farmer, those daily routinely walking barefoot or those have the insect in the atmosphere or the daily living environmental side. So we have to instruct there for the daily examination of the shoes and the foreign body object in the shoes. Monitor signs and symptoms for hypoglycemia to alert patient into imbalance of insulin or the glucose. Instruct the patient to carry emergency identification card to facilitate treatment by the other. If any emergency patient get collapse or the patient get any giddiness during the public place, that time if the patient has the emergency identification, then suddenly the other public transport also can help them for the emergency management. The last nursing care plan for this session, the risk for peripheral neurovascular dysfunction related to the vascular effect of diabetes. For achieve this, we have to plan the goal, to implement measures to increase peripheral circulation status. For achieve this, we have to intervene that perform comprehensive appraisal of peripheral circulation, inspect the skin and arterial ulcer or tissue breakdown to prevent the treatment, to prevent the complication, to provide the treatment and prevent the transmission, protect the extremity from the injury, maintain adequate hydration, and decrease the blood viscosity. Encourage client to the exercise as tolerance to increase peripheral circulation. Health education is the undivided part from the nursing care. So we have to go with the health education always. So we are going to in brief in all the points with the health education. First point will be understanding of diabetes. Here, understanding of diabetes will be the view of patient. The patient should know the how types of diabetes he is having. If the patient is a type 1 diabetic mellitus or type 2 diabetic mellitus, or the some women who have the pregnancy and they get the diabetes mellitus, if you look gestational diabetes mellitus, the role of anti-hyperglycemic medicines and the insulin, how they are working, they should have to know about the which drug, as Baswant sir says, the which drug they have to take with the meal, before meal or the after meal. So according to this patient, we have to provide the health education to the all clients. Then will the healthy diet emphasizes the importance of diet rich in fruits, vegetables, whole grains, lean proteins, and the healthy fats, which will the impact on food choices on the diabetes. Here we go with the as we take the food in our body, the body will be acted such like this. So we have to go with the impact of food choices on the diabetes. Physical activity. Encourage the physical activity tailored to the individual abilities, performance, guidance, and the pranayama, yoga, and the daily routine. We are not allowed. We are belong to the ancient era of the Sanatana. So we have to go with the pranayama yoga, which is the low cost physical activity, or the we can perform in daily living activity in the daily, at the home care setups also. We don't need any the gym or the any kind of setups for the pranayama and yoga. We can actually give a suggestion for the client for the pranayama and yoga. Medical management will be importance of medication adherence to the timing and self-admission techniques for the insulin. Here we have to educate the client for the self-administration techniques for the insulin. Blood glucose monitor. Explain when and how, often to check blood sugar level and what to do if reading is too high or too low. discuss the significance of HbA1c testing for the long-term glucose control, prevention and management of complications, importance of medical checkups and screening for the prevention from diabetes-related complications such as retinopathy, neuropathy, nephropathy, and the cardiovascular system. Stress management will be and the emotional well-being. So we have to go with those aspects also. Provide strategies for the stress reduction and the coping mechanism, such as mindfulness. For example, relaxation techniques, seeking social support. Lifestyle modification. Here we go with the weight management, adequate sleep and rest. Here we client found with the heavy desk job and the BMI also get. So we have to go with the specifically the weight management for the weight reduction and adequate sleep and resting pattern. Sick day management, monitoring blood sugar level and the staying hydrated, adjusting medicine. Here the sick day management means if the client found with any symptoms such as the hypoglycemia or the hyperglycemia and he is taking the care in the home base only, then he should consult with the doctor by the telecommunication also, then for the adjusting the dose of insulin or the oral hypoglycemic tablets. The last point is the long-term realistic goals such as achieving targeted blood sugar level or the losing the weight, adopting healthier lifestyle. Here we have to consult the patient for the achieving the realistic goal for that maintain a targeted blood sugar level, ideal weight, and adopting the healthier lifestyle. As the conclusion for my whole case presentation is the 60 years old XYZ patient hospitalized with the uncontrolled hyperglycemia and previous history of cerebrovascular stroke with the oral hyperglycemic management before admission. During hospital management, we found with the client as the management with the closely monitored with the insulin therapy and found control over the diabetes. After correction of the blood investigation, here we use the word blood investigation. We found the client with the 8.8 HB. We are go with the during hospitalization with the blood transfusion with the sliding scale and the insulin patient discharged with the hospital. The reference used by me, the Chintamani Lewis Medical Surgical Nursing Assessment and Management, Clinical Problems Illustrated, first edition, 1245, 1255. Thank you for.
Thank you, Serendri, for the wonderful presentation. I hope everybody has gone through the presentation. Now the session is open for discussion. If you have any doubts, if the participant has any doubts, you can raise your hand or you can ask the question. You can unmute yourself and ask any question regarding the case presentation or oral anti-diabetic agents.
First of all, I would like to congratulate Dr. Basawant. Very well presented. It was like doctor presenting the medical management. So thank you, Dr. Basawant. And also, after that, his presentation by Sairandri. I have one doubt, like with insulin only patient was discharged or like what was the discharge plan? Whether patient was on like back to the oral hypoglycemic drugs or with the insulin? Because as you said, initially before admission, patient was not on insulin.
And on conclusion, patient was on insulin.
Yes. Sir, patient discharged with the insulin for the side scale, the 10 minutes morning for breakfast and the 10 minutes at the evening for the before dinner. And oral hypoglycemia with the imigran and the diploplasm only.
So teaching of self-insulin is also important in this case. Since how long patient is suffering with diabetes?
Patient suffer with the diabetes with the cerebrovascular accident last 3 years. But
Okay.
patient is
Then he got
yes. Patient is advanced with the oral hypoglycemia with heavy workload and the come for the follow, and he get the complication for this.
okay. Thank you. Any doubts from participants also we can encourage any doubts, especially for case presentation. There are many participants since joining no video. Okay, so kindly switch on your videos, at least to see your faces.
Participants are requested to put on their videos.
Brunel Gaikwad want to say something.
Mute yourself.
Yes, Brunel Gaikwad, Gogavle, sorry. Brunel Gogavle. She want to ask something.
No,
Okay. I think it is by mistake.
yeah, it is by
You don't
mistake.
want to ask any question.
I hope there is no question. All the doubts are cleared. And shall we wrap up the session, sir?
Before that, we have to see that feedback link is shared, and they have to.
Yes, Pooja ma'am.
Yes, sir. Yes, sir. I'll be sharing. Just wait for a 5 minutes. I'll be sharing the feedback form, and just
Okay.
participants are requested to fill the form right now only, because last session we got only 17 feedback and it is very low. The attended session was 42. The participant who has attended is 42, and we have get only 17 feedback and it is very less. So I requested all the participants kindly fill the feedback form.
Just make it sure that you like submit your feedback forms. Just now, because afterwards you forget.
Yes, its feedback is mandatory, dear participants. And also attendance. Tell your friends and colleagues to attend the session.
I have shared the feedback form in the chat box. Kindly fill that feedback form.
To all the participants, the feedback form is already there in the chat box. Kindly open the chat box and click on the link. So you will get the form ready there and you can just go on filling the form. And it is mandatory. So I request each and every participant to fill the form. If you have any doubt regarding the feedback form, you can ask a question on the chat box or you can call me.
Please participate in the session. This is for you only, for your knowledge. And if you will not ask any question, there is no use to conduct the session for you guys.
Yes. Without feedback form will not be issued certificates and also will not consider attendance.
No, this is especially for nurses, and as the sessions are for like nurses to become educators. So as far as this like today's topic is concerned, we should know what is our role in administering medications. At least we should know what is the functional class of that drug, whether it is antipyretic, anti-diabetic, oral hypoglycemic, or insulin, or like diuretic. Okay, this like so that we can educate the patient, like whether to take drug or not to take drug, or how to take drug just before food, after food, or when like you should be able to clear the doubts of patients, especially when patients give the drug by mistake. If sometimes patient forgets, so all those things like you should think. I know like many nurses are working very like expert. They are expert in like giving medications, but still many things we are not knowing, like not clear, especially administration of medications. Even insulin also, maybe next class we'll have in detail what is insulin, like types of insulin.
I hope participants are filling the feedback form right now. You have to fill it, you have to fill the feedback forms right now and submit it immediately. It's a kind request. Because we see here, there are 42 participants, but there are no feedbacks from the participants. We have only 12 now. We have received only 12 feedback forms. So it's a kind request, all the participants to write the feedback forms. Just fill the feedback forms and send it immediately.
Whether they-
Okay. Before leaving, our next session will be on 3rd May, that is the next Friday. We already have planned the sessions on every Friday, but tomorrow is the foundation day. So we have taken session today on Thursday. The next session will be on Friday, 3rd May. And I hope all the participants will join the session. The session timing is from 2 to 3:30 p.m. And the session will be on insulin therapy, and session will be taken by Dr. Veena. So I kindly request all the participants to join who are very keen to update their knowledge, and they have to join the session by on next Friday. Thank you.
And ma'am, who will be going to do the case presentation?
Case presentation.
Yes, ma'am.
Decided.
We have not yet decided, madam. So
Okay, ma'am. Okay, okay.
we will
maybe
get the
maybe huh?
yeah.
Yes.
They have taken class either from Pune or because the session expert is from Pune, so I'll ask her
Okay, sir.
whether from Pune hospital, like Pune Bharti hospital, they will be doing, or else we'll have from our side also.
Okay, sir. Okay, 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 okay. Thank you,
In
sir.
couple of days, we'll decide that.
Okay, sir. Okay, sir. Okay. Can we wind up, sir? If the session is over?
Yes, yes.
Most of the participant has filled the feedback form. Can we wind up?
Yes, yes.
Yes.
Yes,
Thank you so much, sir.
Thank you.
ma'am.